Morning, everybody. Back here again. First time posting in a while. The last time I posted was before Thanksgiving. Just giving you an introduction at that time. Today, I just want to talk about my job as an EMT. I just want to give the youth, some kind of leadership or guidance to any kind of careers. Like I said in the last video, of what's out there and what to expect from each job that hopefully I get to interview what people do for a living. So my main job is EMT. I've been an EMT for about 13 years now with the Navajo Nation. In my job duties, we're required to not just save lives, but treat patients that call us for help. We cover a bunch of injuries from like simple things like bloody noses to people feeling sick, abdominal pains, scratches, cuts, bruising, people who were assaulted, people in car accidents, rodeos, basketball games, football games, any kind of injuries that happen at that time or event that's going on. With the Navajo Nation, we're required to be licensed through the state of New Mexico. Even though I live in Chinle, we're still licensed through New Mexico. New Mexico has standards for rural EMS, and that's what we're working under is New Mexico licensure. But in the state of New Mexico, actually throughout the United States, there's some states that have a thing or licensing or certification. It's called National Registry. So once you get nationally registered as an EMT, you're basically your license or your certification. You can go throughout the different states that recognize the National Registry for EMT work. So through New Mexico, they just recently started that. I think about 3 or 4 years ago, where they recognized National Registry. When I started, they were only strictly licensing through New Mexico. So New Mexico is a rural state. It's wide open space out there, and that's why Navajo Nation went under New Mexico standards. I went to school at NPC for like half semester, and I was certified to I guess through Arizona. Even when I did that, I still had to go through National Registry and try to get certified through Arizona. There ain't no really much difference being an Arizona EMT and a New Mexico licensed EMT. The differences are, like in Arizona, the EMTs there, they can give IVs after 6 months, I heard. Through New Mexico, we only got one drug that's different, which is Narcan. Use it for opiate overdoses. The drug is crazy. Yeah, it's cool. But another thing that we can do in New Mexico that Arizona can't is we do needle sticks. We're allowed to use certain drugs and give it through needles. When I came to New Mexico, I had to do a certain training, and I had to get I guess trained on how to use needles and stuff. But not much of a difference. Everything's all the same. We do everything from giving drugs, certain drugs that we can give, to I guess backboarding people when they're in car accidents, or if they got neck pain, back pain from any known trauma, fall, whatever. We're trained to do hair traction, which is pull out. You got your bone, your femur bone in your leg, your thigh bone, which is when it breaks, it kind of stacks like that onto each other because of the forces or whatever that happened to break that bone. So you put a hair traction, and you clamp one side of the hair traction to the hip, and then one to the ankle. Then you pull the bone apart, and it sits back straight like that. So we're licensed to do that. Well, actually, we're trained to do that. Of course, splinting and broken arms, shoulder sprains, ankle sprains, first aid stuff like that. Being in EMS for 13 years, I've pretty much seen everything. Craziest calls, simplest calls, from having somebody call in for a bloody nose, or somebody that calls us for a stupid reason, like trying to get into the ER, from them waiting in the lobby of the emergency room for something that's not emergent. They call us and try to sneak their way back there through the ambulance, but it still don't work that way. Emergency calls are first. Whoever is the sickest will go back to get a room first. Stuff like that. Gone to numerous accidents. Of course, rodeo events, we've been to those. Any kind of events, actually, sports related, been to it. Anything, everything can happen in EMS. Of course, deaths is one of the main things that drives everybody away from being an EMT. The sights, the smells. People don't want to deal with that, especially being Navajo. It's a taboo. They say yeah, but I'm traditional myself. But there's somebody that has to do it. Our people need help, and I'm willing to go through all that to help, to help people. So, like when I started working with EMS, with our field offices, I think there's like 13 or 14 field offices throughout the Navajo Nation. We get 8 to 8 hour shifts, or actually our hours are 12-hour shifts, 8 p.m. to 8 a.m. or 8 p.m. to 8 a.m. Either one, or 8 a.m. whatever. Morning shift, day shift. We recently added a evening shift, which could go from 10 a.m. or actually 10 p.m. to 10 a.m. to 10 p.m. or 12 to 12. Either one, whichever our boss schedules, which is pretty helpful for our crew. We run one ambulance through our field office most of the time, but when we have the evening shift, then we run two ambulances, which is pretty cool. Helps us out. I think we're the busiest on the Navajo Nation. Yesterday, we had a staff meeting. My boss said we average close to 200 calls, a month. I think the revenue that we brought in through our patients and patient care for the Navajo Nation, cleared over $1 million. 1.2 million is what my boss was saying yesterday, and that was for 2019. It's 2020 right now. But yeah, it's cool. EMS, it's not for everybody. When I first went to take my classes at MPC, my instructor, her name is Tina Tisei, she was telling us, you know, if you can't handle blood, if you can't handle death, if you can't handle seeing a kid go through pain, you know, an infant, then this job ain't for you. If you're not ready to see any of that, if you're not ready to experience any of that, I suggest, you know, changing your major or going to something else. And it's true, you know, it is true. If you can't handle seeing, you know, little kids go through that pain, or, you know, when it comes to the worst thing possible, death, then it's not for you. If we go through any kind of traumatic situation that we can't handle, we do have a debriefing, which is I guess talking to somebody like our bosses are certified in that. They went through some kind of training to help us out. You know, if we need somebody to talk to, they're supposed to be there to help us out. They say, you know, yesterday our boss was saying, you know, there is such a thing for people in public safety, not just officers or like the military personnel that go through PTSD. That's something that they try to help us out with. I had to do that a couple of times, you know, a couple of tragic situations, and I did have to go through debriefing. But yeah, it's pretty cool. I suggest, you know, it's a good job to go, and good career to start off. You know, if you're looking to be a nurse or a doctor. I mean, we people in our field have done that. They become RNs, and, you know, some have become doctors. It's a good place to start, because, you know, we're kind of that bridge from the scene that we see somebody on scene or some kind of situation to when we get to the hospital. You know, we're the first ones there on scene, and it's something that we have to help our patients with. And it's a good feeling to help somebody. And it's I thought I would get tired of it, but I'm not. It's cool. I mean, you know, I wasn't one of the smartest people in the world, but, you know, I got through it. Got through the classes at MPC. It's cool. You have to keep a 80%. You have to keep a B average in our classes, which was something that I had to do, because I was driving from Chinle to White River every Monday Monday and Wednesday, and, you know, classes were like 4 hours long, 6 to 10 p.m. Drive out there, get back like about 1 or 2 o'clock in the morning, study, and then try to make it back on Wednesday. And so yeah, if you guys want to be an EMT, you can do ride-alongs with us, with Navajo Nation. They do ride-along. They have a ride-along program. Just go to your local EMS office or wherever, you know, if you're interested. Talk to the supervisors there. I'm pretty sure that they'll let you, because we do have that program. And with Navajo Nation, they do pay for your schooling. They'll send you to training, you know, if you get hired on as a permanent. We have a permanent position and a temporary position for interns. There's some experience required. I mean, that's up to your local agency or whichever field office you want to work for. If you get hired on as a permanent position, they'll send you to basic school, which is, you work on your to getting licensed as an EMT. The interns is kind of like on-the-job training. Mostly do driving, first aid stuff. You'll assist the licensed EMTs with whatever duties they have. That's with Navajo Nation. And I don't know if other tribes do that or other entities out off the reservation. I don't know if they'll allow that, but with Navajo Nation, it's cool, they do that. But for me, I had to pay on my own. I went on my own and went through all that stuff. Got my financial aid and stuff like that to pay for it, just like regular school. So back to being the permanent and temporary position. So if you're a permanent, you get to get your school paid for. You have to have your CPR. Your CPR, first aid, your driver's license, for Navajo Nation, of course, probably driver's license for any other EMT job. But yeah, go visit your local EMS office and try it for a ride along. With Chinle, I know we allow it. We're the busiest office, like I said, so come on out if you guys want to check it out. We're required to wear vests with Navajo Nation, bulletproof vests. Not many officers on the reservation. Maybe the most you'll get on a shift is probably 4. But most of the time, they say they have only a couple officers available. And with EMS, we cover a pretty big area. I think with only one unit, we try to cover at least, 100,000 people maybe. Transports last for anywhere from 5 minutes to 3 hours, depending on where the call is at. We cover places like Noslini, Rough Rock, Little Pass Rough Rock, Buffalo Pass, to the top of the mountain to the picnic area, almost into Sawmill, on top of the summit, over Route 7, which is on the south rim of the Candy Shea, and all the way to. Sometimes we'll cover Pinion's area if they're busy, but Cottonwood is in our area also. Yeah, we go everywhere, anywhere. We try to help our people, try to be there for them, And like I said, EMS is not for everybody. If you feel that you want to get your feet wet or whatever, come in and do a ride along. Just talk to your boss. All you have to do is sign a waiver form. If you're not 18, your parents can still sign that waiver for you. So hopefully, my other videos, I'll try to get other careers going. I'm pretty busy right now. That's why I haven't done any videos. Coaching basketball, like I said, Chinle High School. We have a game tonight against Tuba City. Lost the other night against Page, who they're ranked number 1 in the state currently. So I think we're sitting at 6. Netflix, Basketball or Nothing 2. The crew is out. They're not filming right as of now, but they were a couple weeks ago. But season 2 should be out. I don't know how long. Can't give you a timeline for that, but they are currently filming it. Other than that, thanks for watching, and see you next time.